The future of insurance is set by what takes place in adjacent industries. So the future of health insurance is set by developments in healthcare, the activities of big pharma, healthcare providers, and of companies innovating health tech. Philips is such a health tech company striving for better health and well-being through meaningful innovation. In their keynote today, Emily Napier and Raymon Buiten will focus on women's health. They will share why this focus is needed and how Philips is developing services to add value to people's lives and women in particular. It is our real pleasure to have these experts on our stage. Please a warm welcome for Emily and Raymon.
Thank you so much for having us here today. My name is Emily. I'm the new business lead for Philips Europe, and I'm here today with my colleague Raymon.
Hi everyone, I'm Raymon Buiten. I lead the health insurance solutions within our women's health space.
Fantastic. And we're here today to talk to you about a very important topic, not just to us personally, but also to Philips, and that is women's healthcare. And we'll be talking about how we fix the inequities through preventative care. So we wanted to start by saying, why are we as Philips here today talking to you about women's healthcare? It might not feel like the most natural link to some of you. I don't know, when you think about Philips, you think about lighting, TV maybe, but actually we've been transforming to a healthcare company for the last several years, and we really are on a mission to become a health tech leader. So our mission here, and we wanted to share this with you, is to improve the lives of billions of people per year by 2030. And 400 million of those are underserved communities. Now this is interesting, and it might come as a surprise maybe to some of you, but actually one of the largest underserved populations are in fact women. So we know that there is a huge disparity in access to care. Symptoms also present very differently in women compared to men. And this can also lead to a delay in diagnosis. And there are a lot of women-specific conditions that there are still not treatments for, even as I stand here today. So we really need to get together and look at how we can fix women's healthcare. So today, throughout the presentation, we'll be talking about the data gap, some of the causes, and how we can make a difference. So we wanted to start by looking at the women's healthcare journey, and through a timeline here represented. Women's bodies are very different. We have different hormones, different organs. So when we look at, and we've got the stages from puberty through to post-menopause, and there's lots of different conditions, and especially when we look at dysmenorrhea, which is really around the debilitating pain that a lot of women suffer early on in their lives. And then within menopause as well. So we know the statistics that nearly 60% of all women are taking time off due to different symptoms that occur during menopause, and actually 18% that have taken more than 8 weeks off. So this really is something that we need to start addressing, and menopause is a topic that recently has got a little bit more publicity and press, but this is only the start of really addressing some really key critical issues. And then when we look at conditions such as endometriosis, so this affects 10% of all women, but yet there is no treatment. So even a full hysterectomy, there is no cure at the moment. And this can also lead to infertility. So when we talk about pregnancies, they are becoming more and more high risk. And this is due to varying factors such as lifestyle changes. People have more sedentary jobs these days, but actually also due to other conditions are really such as maternal age increasing is really driving the infertility rates and having more complications on pregnancy. And then we look at some of the other areas, such as osteoporosis and dementia, and people aren't aware how much, even though they affect both men and women, women are disproportionately affected more times than men. So this really is many, and this is just a few examples of some conditions, but we know there are a lot more that are affecting women's healthcare. So, we talk about this topic today, and a lot of people say to us, oh, well, it's complicated or it's a niche area, but actually, of course, women account for 50% of the population. So, we're not talking about a niche population or a niche target group here. And we've been talking with some public health companies and insurances over the last year, and a lot are starting to develop programs specifically for women's health. But if there's any insurers with us today who haven't yet started looking at this area, I think it's a nice moment to reflect on what you can do and how you can start to prioritize this.
Now, this is a little bit of difficult statistic to look at because even in the EU right now, still every year about 1,000 women die due to something that should be very natural and normal to a lot of people, which is dying during pregnancy or childbirth. And the most difficult part of this, even though it's already large numbers, is actually 60% of that number is preventable. If only these women had more access to care, better services, were getting access to preventative solutions throughout. Now, it's not that surprising if you look at also that only since 30 years we've started to actively collect data about women in a clinical fashion. So there's a huge data gap when it comes to knowing and understanding women's bodies, but also how they react in terms of healthcare and health treatment. So take as an example, for instance, something like chronic pain. About 80% of all chronic pain is experienced by women. But at this point in time, just about 30% of all the research is dedicated to women. So there's a huge disparity when it comes to clinical research. Now, furthermore, this is a space that is very much underinvested right now. So it's very much a white space where we can also invest to improve better outcomes, to improving cost of care, and also actually create a lot of savings because of the healthcare issues that are costing a lot of money as well. Now, this is in contrast with something that's really interesting because women, by and large, are not only the gateway to their own health, they are the gateway to health in general. And why is that? It is because they are the healthcare decision makers, but also the insurance decision makers out there. Just as a couple of examples, so 90% of primary healthcare decision makers are women. So they make the decisions for themselves, their family, and people around them. They are the caregivers in that sense. Also, they are by and large much more likely to use digital health tools. So if we want to do something impactful through preventative health, actually, women are way more likely to adopt those solutions. Also, about 80% of healthcare spending is done by women, which includes also insurance healthcare spending. And in general, and a lot of people might know that, 80% of all consumer purchases are done by women as well. So we really should rethink also if we talk about healthcare, not only in the context of supporting women, but actually also as they are the gateway to support health and improve outcomes for a lot of people. Now, we're here at this event because we believe strongly that a lot of people need to come together actually to make an impact. So organizations from government, from companies, from providers, they all need to come together. Governments in terms of the policies that they make, that they ensure that the right funding is in place. Companies, that they have the right benefits and the right support in the workplace, but also companies like ourselves and many of you out there in how do you support and create innovations for these women. Next to that, obviously, providers. If you talk about a condition like endometriosis, which has an 8-year typical time till diagnosis, it means that there's such an opportunity to improve then also the diagnosis, preventative screening, and so on. But there's a very specific role for insurance companies, and that's why we're here also to talk with the people at this conference. So very specifically, insurance companies have the ability to really drive the access to care through preventative health. And that's something that we think is really impactful. So for sure, insurers have a key role to actually change the tide in women's health. Now, there's a very specific area, and you heard us talk about that already, that we're focusing, and that's pregnancy. So our mission is really to improve the health and well-being of every expectant mom and mom-to-be. And we take that mission very seriously. That's something that we've been doing for years and years and years, but we really feel that this is an area that we want to make an impact in. And we want to do that in multiple different ways. We always talk about the quadruple aim of improving health outcomes, in lowering cost of care, improving staff experience, and improving also overall the care that we give to these individuals. But there's something very specific about pregnancy because it represents a life stage with so many different changes. So if you look at whatever changes in just that very short 9 months moment, it's basically people are rethinking their entire life, healthcare spending. Do I need to have life insurance? Do I need to buy a different car? Do I need to get a bigger house? There's so many changes that they are, at this point in time, very much aware about. And our experience has been, if you connect with people during this moment, you build up a special relationship. And that really enables you to become a life partner for all of the phases afterwards. So it is also a critical moment to be there for individuals.
And we have more than 30 years of experience in supporting mums and babies. So we're super proud, and some of you might know some of our products, such as the Avant portfolio. We also have different services and digital platforms, and electric toothbrushes, our Sonicare portfolio. And actually, we'll touch on the links between pregnancy and oral health a bit later on. We also have the clinical solutions. So we have a lot of hospital care and equipment and monitoring devices. We also do at-home monitoring and diagnostics. And then the partners we work with are super critical. So as Philips, we can't do everything, we can't be everything. So we really need to work with partners to provide the end-to-end service to our end users. And this just gives a few illustrations of some of the partners that we work with, such as the White House, the CDC, NHS, and the Bill and Melinda Gates Foundation. And we're looking to expand our partnership opportunities within this space as well. So obviously, parenthood in general, everyone's very driven to want the best for themselves and for the baby. However, there can be a lot of challenges that people face along the way. We see that 75% of all women fall outside of the recommended healthy weight gain. And that can lead to 11% of women actually experiencing gestational diabetes. So we know that the maternal age is increasing. So we see 20 to 30% are actually getting pregnant after the age of 35, which can cause additional complications later on. We see also high levels of anxiety, with more than 10% experiencing this. I think pregnancy can be a very overwhelming, hopefully positive, but overwhelming experience for some. And we see that also there's a level of inactivity, with up to 60% maybe not being as physically active as they could be. And then this leads to some other issues, such as 10 to 15% of women experiencing postpartum depression. So these are the ones that seek clinical support from healthcare professionals. So unfortunately, the number is actually likely to be higher than this. We also see an increase in maternal mortality, and Ray touched on a few of the statistics at the beginning. But this really is something that needs to be tackled and to be addressed. And then the number of C-sections as well. So in Europe, we see 25% of all pregnancies being C-section versus the recommended 15% by the WHO. So we really believe that we want to get people into the best care possible, and preventative healthcare is always better when we can do this. So providing the right care at the right time. So why is this important? Well, of course, we want to target people very early on in their pregnancy. So if you look at pregnancy being 9 to 10 months long, most people only inform friends, family, providers in their second trimester. However, if you can reach them very early, you have the access to be able to change, adopt, educate, and tailor healthy behaviors that will support them throughout the pregnancy. And then we look at accessible and expert-led content. So I think we can all go onto Google and look up 1,000 different articles and have questions, but actually, how do you know that that's been written by a healthcare professional or an expert? Is it credible? Is it trustworthy? There's a lot of information out there, but providing the ones that are expert-led is super important, and having all that information in one easy, accessible place is what people are looking for. And then finally, we all talk about personalization. Of course, that's very important. But particularly when you're thinking of pregnancy, everybody is very unique, and everyone's situations, backgrounds are very tailored towards them. So what we're looking to do is create very personalized, immersive experience during this time, which is very emotive to a lot of people. So we know if you can do that, that really helps to bring loyalty, satisfaction, and ultimately retention of the users. So some might not know that Philips actually own an app called Pregnancy Plus. So this is the world's #1 pregnancy app. Every 5 seconds, a new mum joins Pregnancy Plus. And actually, we have over 80% share of all pregnant women in Europe that use Pregnancy Plus throughout their journey, which we're really proud to be able to support. Pregnancy Plus was an acquisition by Philips about 6 years ago, but it's been around for 12 years, so as long as the App Store was created. So no other pregnancy app provides the scale and support that we're able to do. And then if you look at our users, so we have 11 million downloads every year, and since it started, 75 million to date. We're really proud of the positive App Store rating of 4.8, and you have over 2 million reviews on there as well. And then recently, Forbes voted us the best pregnancy app of 2023. So I think these statistics tell you a little bit about the app, but we thought it would be great just to share a quick video which really brings to life what the app is all about.
pregnancy symptoms, the changes that you can expect during the first few weeks of your pregnancy, the do's and don'ts during your pregnancy, sex, sleep and exercise.
Welcome to your morning yoga flow class. This is a great way to begin your day, both to re-energize the mind and the body.
Together with Pregnancy Plus, we will look at key psychological factors that can arise during the perinatal period, focusing on how your past can shape who you are now.
Fantastic. Also had a sneak peek at this one, but as we're in beautiful Barcelona, we wanted to share the statistics from Spain with you. So if we look at the number of live births in Spain, we have about 336,000 per year, and we have 285,000 users of Pregnancy Plus in Spain. And nearly 80% of those download Pregnancy Plus in the first trimester. So when we talk about early access to care, this is really the perfect opportunity to reach people at the very beginning of their pregnancy journey. And we cover a good range of ages from across the board. We have quite an even split as well. So in terms of target demographic, this is a great time to really reach these people early on to get the preventative start that they need.
Now, like we said, so one of the most important things that we want to do is actually improve the outcomes of people throughout pregnancy. And Pregnancy Plus has very much proven that we're able to do that. So as an example, if we talk about health awareness, people are way more aware of what is healthy or not healthy during pregnancy, and actually they believe that they had a healthier pregnancy as well. So it really helps them to be educated in that sense. Second, in terms of health intervention, they know better when or when not to consult a physician, and also 52% actually indicated that they consulted their physician, their doctor, less because of Pregnancy Plus. And that's not something that we actively promote. It's not like we want you to go to the doctor less. Actually, in the most of our articles, we always kind of comment, if you feel uncertain about something, please consult your physician. But still, people felt that their questions were answered already within the app. And the last, which is really about the experience, we see that people just in general feel much more educated about their own pregnancy experience and much more confident. And I think that's amazing. If we can reach that many people, 11 million people every year, and then make them feel more confident about their pregnancy, that's awesome. Now, I want to share a couple of examples of things that we do out there in the market. So we actually work with the US government to provide a digital front door to care through Pregnancy Plus. So we use Pregnancy Plus to reach all of the pregnant individuals in Michigan, especially the low-income individuals, to give them access to additional education, additional information, but also help them find resources of support around them. So you can see that we reached, in about 10 months, we reached about 27,000 women very easily because they were already on the platform. We helped them to get in contact with the content that was in the app over 600,000 times. And they took action over 8,000 times to get support as well. And the things that I'm most proud about is actually that what you see there at the bottom is people are really also actually valuing the additional information that we give to them. So they really value that we provide them access to care and vital resources that are potentially very valuable to them as well. Now, we're going to be launching this soon as well in the EU. So further down the year, you'll hear more about it in the near future. We're actually launching this with a couple of health insurers in EU in Q4. So we have two companies that we're partnering with to bring this towards their members as well. So you'll hear more about that as well. Now, Emily mentioned already in the beginning, there is a very strong link between dental care and pregnancy. And we wanted to highlight that because during pregnancy, systemic health and holistic care is one of the most important things. And as you might not know, about 75% of all individuals during pregnancy develop a condition called gingivitis. And that's a precursor to periodontitis and could lead to poor pregnancy outcomes. However, we know, and this is not unique, I want everybody to really get that, this is not unique to pregnancy, but people have poor dental habits. They just do. And in pregnancy, we actually did a survey where we showed that a lot of people are not brushing the teeth, the recommended twice a day. So 45% just brush their teeth once a day. By and large, a lot of them do not brush the recommended 2 minutes, as we all know and are taught. But also, quite a lot of people are aware that actually it could have an impact on their health and the health of their unborn baby. So there's something really strong there to do. We ran a study for about 12 years in the US with an organization in Virginia where we actually provided people with pregnancy care and dental care through our Philips Sonicare solutions. And we saw a reduction of 30% in preterm births. So and I want everybody to understand that's just not because we provide them with a toothbrush. The people who are that active with preventative health, just in general take better care of themselves, are more aware of the things that they should be doing, and that has a huge impact. And that's the preventative care that we're talking about. So that holistic aspect to pregnancy, that is really important.
Perfect. So we just wanted to finish up by giving you the key takeaways to take out from the session today. So hopefully you've seen that women face very unique challenges, and with 50% of the population, it's not niche. So we know insurance companies have a really key role to play in prioritising women's healthcare, and women are the gateway to impacting health for them, but also for their families. Pregnancy really is a pivotal and a very key life moment, so if you can help and be there for people at this time, then you can really build relationships that last a lifetime for lifetime partners. And finally, preventative care, so it supports women with the right start throughout parenthood, but also beyond. So we believe the time for change is now, and that we should be prioritising women's healthcare. So if you'd like to join us on our mission to support women during pregnancy with a better and healthier start, then please get in touch. The QR code here links to the email where you can reach out, but we'll also be at the event. So if you want to catch up with us over the next 2 days, please do. Thank you so much for listening.
Thank you very much.